What I'm going to show you is how to manage small lips as well as the patient expectations, get a good result without downgrading your patient. So you can always try again in the future to add more volume in a more controlled way. It can be helpful before you start just to ask yourself, when you move the lip, what makes your patient prettier? Because this gives you an idea about where volume needs to be. I would be very happy to elevate the middle of a lip and the lower lip in the central 1/3. The more I look at the lateral lip, the more you think, don't do that, because you can see she looks sad. Similar with the lateral lip at the top, you start to look a bit snarly. So it's really all about elevation, generating height and projection in the middle 1/3 of the lip while preserving the detail. So to do that, there are two types of injections you might do if you're using a needle. Horizontal injections are going to add mostly volume. Vertical injections will add volume and a bit more height. So they may be a useful thing to keep on the cards. Because vermilion border is very well defined, I don't need to work on this. I just need to preserve it. So I'm not going to enter close to it. I'm going to enter just here and create a little bit of projection underneath the GK point. But before they do that, I'm actually going to start with a vertical injection, because this is where I think I'll get most of my early wins in terms of vertical height, which is what this patient wants most of all. So vertical injections are harder to do in thinner lips because you just got less space. Imagine if her natural lip was like this, you'd have more space. So that's actually one thing you can do with your patient, is rotate their lip up, and it gives you a little bit more space. Now be aware, as you do this, in theory, the superior labial artery is also being pulled out. You can sometimes feel it underneath or see it, and it's always worth having a look. You'll sometimes see it pulsating. Now, if you're in the right level, you should be above it anyway. So always be aware of your depth. If you're going to do a vertical injection, rotate the lip upwards so that you have a bit more room. We're also getting most of this tissue in alignment, so it's one straight passage with the needle. Not entirely straight, which is also why I'm going to show you something else in a second that will help. So if you're going to do a vertical injection, one of the hardest things is the fact that your needle is quite straight in comparison with the curvature of the lip. So you can do something very simple, which is put a little kink in the top of the needle, and that makes it a little bit easier. Or you can attempt a couple of kinks, basically curve the needle so that you have the ability to follow that curve of the lip a little bit more easily. So I do this with a sterile swab that is soaked in the cleansing agent, and then I clamp it within this and then curve it with a pair of pliers. Okay, there's a little curve to that. The reason that the bevel is down is, as you can imagine, as I'm following this arc, I don't want filler, at least I don't want too much filler to bubble up to the surface, which is a known outcome of this, is you'll see little surface bubbles of product, and you need to just need to massage them until they disappear. I want to reduce the risk of that. So by pulling up, I have a little bit more room. Now, this insertion point here is very important to get right. If you go through here, which is how tenting was done in the past, depending on what term you use, tenting, fencing, some people used to go straight through the white part of the lip, which means you go straight through where the arterials are, and you get a lot more bleeding. And literally, you'd see blood trickling down the patient's face on Instagram back in 2012. Now, we want to do this in a way that decreases the risk of there being excessive swelling and bruising, which means my depth is very important. I always say this is the most important thing with lips is depth control. So look very closely at the surface of the lip. You have the white lip and the pink lip and a boundary where they meet. I never want to go through even the first part of that. Is very, very sensitive. So I want to go just where that is starting, where the pink is starting, and I want to stay in the most superficial plane. So are you ready, Anne? I'm going to inject now. So just prick the skin just where it's starting. Now I'm doing a depth check and controlling the depth of my needle all the way along. I don't want to be going deeper as I go. Depth check. Many injectors won't aspirate here. I don't think it's particularly risky not aspirating if you've done everything else, but it's in my muscle memory now. So linear thread now on the way out. Now, if I'm going to do two, I might as well do them through the same entry point to decrease the amount of swelling likely. Trauma. So I'm in again, aspirated, depth check, linear thread, see the product tracked along the milling border there just as it was coming out. So not all of it went here, which is often the way. I think it's useful to see that product does flow in tissue. It may change what we do next depending on how that responds. This is kind of good that it's superficial. It tells me that I'm in that part of the lip that will elevate. I've got more chance of creating an elevation when I do that. So that's working. So that was 0.05 in each pass. Sorry, because I want to elevate this part of the lip and preserve the natural shape, I'm entering right where the GK point is, hopefully aiding to the shape rather than losing the shape. Just through the surface of the skin, then tracking down anterior border, trying to stay as superficial as I can towards the wet dry border. Aspirate and slowly start to inject as you come out. I did 2 injections last time, so I'm going to go back in and slightly lateral this time. I want to see where the filler is flowing so that I don't, if it starts to bubble towards the surface, I will stop injecting. There is something I learnt when injecting with Julie Horn, is that as if I used to stop sooner, that's actually part of what happened here. If you keep going, you often get a bit more definition in the border. So just a little bit further on, and if filler comes all the way out, then at least give it a little, I think as part of your finishing technique, give it a little squeeze so there's no filler, maintaining the openness of that hole. It's important to do a little bit of what I call a sculpting massage, so that you are getting the shape you want and not relying on the natural path that the filler flows to, because filler flows to low pressure points within the lip. They're not always exactly where you want them. So a little squeeze to create the shape you want often gets you a better result and gets rid of any distracting lumps or bumps. One of the challenges for an injector is how much of what you see is product versus swelling. And the truth is, when you first put it in, you have a rough guide because you can see the product, but within 30 seconds, you're now looking, a lot of it is what you see is actually swelling, not the product itself. So you kind of have to make a mental note, remember how it was just after you put in, and then assess by equal swelling. So when I first started, I was much slower on one side of the face, and it's actually the same with teaching. Often you spend too long on one side and then the swelling is dramatic. So you just have to replicate the movement and the volume and then give an equal amount of time so you can assess the difference, and then treat according to symmetry and experience, because basically with this type of product, 1 mil of something like Volift is actually quite hard to create too much shape or too much volume. So I don't feel like I'm at a lot of risk if I use most of it. That's different if you're using different products that are more voluminous. So before we do the lateral part of the lip, let's preserve the details of the lower lip while also attempting to get a little bit more lower lip show. So I'm going to stay out of the lateral for now, because this is the most important detail that we need to make sure is preserved before we do any lateral work. So we're going to put a vertical injection over that tubercle, similar entry point. Now following the path of the lip border, you can aspirate, depth check, and inject nice and slowly, watching the product flows where it's flowing to, putting in an estimated amount of 0.05 for a pass. So I'm thinking a lot about this tip of the needle, and it's following that depth correctly. Put a negative in the syringe, close that off, and now linear thread as we come out. Now you can do a little sculpting squeeze to preserve that shape. Now if you think about what we've just done, it's all about tubercle enhancement, nothing else, and that actually looks great. I'm very happy with that. Now volume wise, this is a tiny amount, that's 0.05. She has got small lips, so that might be okay, but I could also tell you that from experience, that's probably, when it settles, not going to be as strong a result as you probably want. And we are staying on the natural side, but she also said she wants to feel a bit special afterwards. So it's restoration plus a little bit of beauty. I always think it's healthy. The healthy state of a woman is to feel beautiful.
And a man.
And a man, yes. We all like to feel attractive. Right, so what can I do? I'm still thinking, same approach. I'm worried about this being overdone, and I'm confident in the middle third. So I think we can actually do a little bit better with a couple more injections. Let's do a couple more this way and that way so that I'm creating more vertical height. Try and enter through the same hole. I'm not going to go exactly along the same path. This depth check is to keep my position basically away from where the artery is likely to be. It's usually underneath orbicularis. 85% of the time it's underneath the muscle. So although we are rotating the muscle outwards, I'm also staying superficial. And you can often, if the artery is here, you sometimes can even see it. To be fair, in the lower lip it's usually more inferior than we are anyway. Don't think we're that close to it most of the time. So negative aspiration, linear thread. So I'm using this vertical injection technique because it's the most efficient way to create vertical height. I want to do this with the lips. If you do horizontal, you can still do it, but you also then create more of this. What makes female lips beautiful are these curves in these tubercles. And when I see them get more curvaceous, it looks more beautiful. Everything you do laterally hides that. In fact, you can kind of see it. As I pull this, you can see the curves decrease. So her lip, you see more pink, but she looks less curvaceous. A lot of femininity is basically curves. If I lose that, even if her lips look bigger, she doesn't look more attractive. I think that looks more beautiful because I see the tubercle, I see the indentation, I see the definition. She's got a nice positive slant to her lower lip as well. All of that is under threat the more I put laterally. This is another little test. So if the mid part of the lip, if it is higher than the lateral part, it looks slightly like a frown, only a tiny bit. So when you squeeze it and shape it and you see it looks lower, the person tends to look more positive. It's only a tiny, tiny tweak, but that's why I feel okay also to inject the middle part of the lip again. Changed angle because I want more of a roundness to the lower lip. I'm no longer trying to get it to evert. This is more about a volume type injection. It's a little bit of volume next to where I've created the eversion so that it's nice and round. Lips should look like they are falling out of the mouth. That's actually what they are. They are actually the mouth falling out of the mouth. Evolutionarily, this is the oral mucosa that we've evolved to come out. So that's what you're trying to make it look like. If you learned something from this, make sure you sign up to my upcoming web class. It's all about how good practitioners differentiate themselves and then reap the rewards in business. It's the combination of quality and the reward that you deserve. I'm going to teach you how to get it on the upcoming web class.